Karnataka's MMR to be reduced by more than 40% and aim to achieve global standards, says State's Minister of Health and Family Welfare at a conference organized by RVU and IIPA. Bengaluru, 27 September 2025. In an effort to address the state's maternal health issues, Indian Institute of Public Administration, Karnataka Regional Branch, in partnership with RV University's Center for Global Health and Development, hosted a one-day conference on reducing maternal mortality in Karnataka. It was held at MineRVa Auditorium, RV Center for Leadership and Executive Education, Bengaluru. The conference discussed recent data from the sample registration system. Karnataka's maternal mortality ratio, MMR, of 68 per 100,000 live births stands out regionally. Neighbouring states report MMRs largely in the 30s with Telangana at 59. The panelists explored targeted solutions across taluka hospitals, community outreach, workforce strengthening, and data systems. The event brought together policymakers, public health experts, and medical professionals to deliberate on the causes behind Karnataka's high MMR and to chart an evidence-based roadmap for rapid improvement. Keynote addresses were delivered by Shri Dinesh Gundu Rao, Minister for Health and Family Welfare, and Dr. Sharna Prakash R. Patil, Minister for Medical Education and Skill Development.
With RV University, and RV University has made a name as the most prestigious university in Bangalore, the private university in Bangalore, with a very deep sense of quality, with a focus on quality in education. And they have made a name for themselves, carved out a name for themselves, and they are the top rank in the engineering sphere. And I'm sure that with they will soon become the top private university in Karnataka and among the top in the country. So this conference, we have been, I was earlier chairman of Karnataka Administrative Reforms Commission. So in that report, we had made a number of recommendations about, we had, as chief secretary also, I used to review this MMR, maternal mortality rate. I used to ask officers, health department, as to why our MMR rate, Karnataka's MMR rate. We have the largest number of medical colleges in the country. We have the largest number of doctors probably in the country per population, per 1 lakh population. We have a large network of nursing colleges, paramedical colleges, and a very good health department, which has delivered a number of programs. But in spite of that, Karnataka's maternal mortality ratio is highest among all neighbouring states. The recent sample registration surveys of 21-23, you are aware of that. In Karnataka, our ratio, MMR ratio is 68 per lakh live births. Whereas all the neighbouring states, the nearest is Telangana, which is 58, and the other states are all in the 30s. Andhra Pradesh is 30, Kerala is 30, Tamil Nadu is 35, and Maharashtra is 36. So in fact, I used to find when I went to dealer, ನಿಮ್ಮ ಎರಡು ಕಡೆ ಒಂದ್ ಕಡೆ ಮಹಾರಾಷ್ಟ್ರ ಇದೆ, ಅಲ್ಲೂನೇ MMR ಕಡಿಮೆ ಇದೆ, ಇನ್ನೊಂದ್ ಕಡೆ ತೆಲಂಗಾಣ ಇದೆ, ಅಲ್ಲೂನೇ MMR ಕಡಿಮೆ ಇದೆ, ನಿಮ್ಮಲ್ಲಿ ಮಾತ್ರ ಯಾಕೆ ಜಾಸ್ತಿ? So I think there are a number of issues that need to be examined, because we can't say that not like Bihar or Jharkhand where there are no doctors or there is no health system. Our health infrastructure is among the best in the country. Health department is among the best in the country. But MMR is one area. IMRL we have made a lot of progress. But MMR is one area where we have not made sufficient progress, and we should be in the rank to should be close to Kerala and Tamil Nadu, if at all. But yes. So in this context, we had discussed in IIPA. Ramanathan has also suggested that we should organize this conference. And based on so we have organized this conference when Dr. Ranjini wanted to organize a one, suggested we should, because this is a very the most serious and burning issue in Karnataka, where researchers, medical experts, and administrators should get together so that we find out we can draw up some recommendations for the government.
Most important intellectual school in our university. We've got highest number of publication from limited number of faculty members we have, and the numbers are growing. Our students are publishing in various newspapers and journals. One student has published an award-winning book. They're also active in national and international levels in sports, so they're just not studying, but they're also doing a lot of other activities. The first debating society was set up by the first founding batch. I had only 5 students in the founding batch, and the number has now grown to almost 60. I'm very happy to tell you that all 5 students who graduated last year from our school have gone abroad to study masters in economics, masters in finance, masters in business in some of the top-rated universities, including Warwick, including London School of Economics, and one student has got a position in Institute of Foreign Trade, New Delhi itself. We are
state or district is working. If all the systems are working well, then the maternal mortality should be down, and it should be at the minimum possible level. So, more robust the system, better the MMR. MMR and IMR become a key indicator. More than IMR, I think MMR becomes a very key indicator of the way the health infrastructure of a particular region is. And like our Dr. Ranjini, she while presenting, she said that how Karnataka, though compared to Indian standards, we are better off, and we are doing better than other states in India. But when we compare ourselves to the south, which is comparatively in all indicators, whether it's economic, social, democratic, all these things, all indicators, we are definitely ahead of the rest of the country. In this aspect, when we look at it, we see that Karnataka is behind. In some other aspects, we are better than the other states. But in this particular aspect, we are behind Kerala, Tamil Nadu, Telangana, and even Andhra also. So, and Maharashtra, of course, our western region. So, this is something that is definitely caught our attention too. And we've been, looking at how we can, because this is a very, very important thing, because if a person is dying due to, giving childbirth, then if it could have been prevented, then that is a failure of our system. Time last year, when we were looking at this maternal death, so we decided to, though there is a program of auditing, but we gave it a more, serious look at it. And last year, I told my officers that to look at all the maternal deaths that have taken place last year, and what are the reasons for these deaths that have happened. So this detailed audit was done by our people, and they looked at from April 2024, April 1st, 2024 onwards, till I think when I gave this order, I think somewhere in December. So maybe till December, Jan, they did an audit of all the deaths, and any other death that was being reported was also being looked into as and when it happened. Why it happened? What was the failure? Was there a system failure, institution failure, or was there any other health reason or something which is not identified properly? So we looked at it very deeply, and we came out with our own findings. And this year, in the CM's budget speech, we made it a part of our program that Karnataka aims for, to have a mission for zero preventable maternal death. It is called any maternal death that could have been prevented, it should touch zero. So wherever the gaps are, we need to fill that gap. Certain places, the doctors were not available on time. Certain places, the ANC checkups have not been done. Certain places, they have not been advised properly. So by the time they could reach the hospital, they found the hospital, but then they had to shift to another hospital. So on the way, they pass away. Certain procedural lapses, certain lack of having, some sort of, drugs which are essential but were not present. So In our system, I was looking at only the public system, not at the private system, only the public or government facilities. So then we came out with this program. And our aim is to have, though our number is 68, it's come down according to our own figures right now, it's around 60, around 60 right now. So, and we started implementing this program. And I would like to